Hello, my name is Vicki. I'm in Nursing 215. I'm going to give instruction on how to do a head-to-toe assessment. So you have a new patient, you want to assess them, make sure everything is fine, they don't have any wounds, any other issues going on besides, of course, what they came into the hospital for. So the first thing you want to do is you want to identify yourself to the patient. You want to let them know, my name is Vicki, I'm going to be your nurse today. You let them know what you're going to do. That's very important. I'm going to do a head-to-toe assessment with your permission, just to kind of assess everything, make sure that everything is okay, see if you have any questions or issues. I will need to touch you. I just would like your permission to touch you. Make sure you ask them for their permission. You'll wash your hands. Make sure you wash your hands really well. You're going to start, like it says, head-to-toe assessment. So I apologize, I don't have my pen light, but you would check the eyes for pearla. You would check the nostrils to make sure the mucus is that it's moist, not dry. You would check the mouth, make sure there's no lesions or the mouth is not dry at all. You could ask the patient if they're in any pain. If they are in any pain, you ask them what level the pain from 0 to 10. If it warrants pain medication that is ordered, then you will have to go and get that patient that pain medication according to the orders. So you're going to check the ears. You're going to make sure there's no drainage in the ears. You're going to check the lymph nodes, make sure that there's not any inflammation in the lymph nodes. You're going to determine their mental status. You're going to ask them their name, their birthday, if they know what year it is, if they know where they are. So you want their mental status to be, or you want them to be oriented times 3 or 4. Also, as soon as you walk in, of course, you always evaluate the ABCs, the airway, the breathing, and the circulation. Make sure everything is okay. You want to listen to the way that they're speaking. You want to make sure that their speech is okay. Then you want to take their vital signs. But you let them know everything that you're doing. I'm going to get ready to take your vital signs. I'm going to get ready to, touch your lymph nodes, your ears, your eyes. Always ensure that you're letting them know what you're doing through the entire assessment. So you'll just let the gentleman know that you're going to take his vital signs. You notate the vital signs within normal limits, or if the blood pressure is high, you note that. You also want to note their skin. You want to note their skin color. You want to note the temperature of their skin, the turgor of their skin. You want to inspect their respirations while you're doing the vital signs. Then you want to tell them that you're going to remove their gown so that you can listen to their heart and their abdomen. So the heart, you're going to listen to the apical pulse for 1 minute. So you'll listen to the apical pulse for 1 minute. Then you want to tell them that you're going to listen to their bowel sounds. Ask them when their last bowel movement was. When you do that, you'll listen to all 4 quadrants, 3 to 5 minutes until you hear 2, 3, and 4. You'll notate bowel sounds in all 4 quadrants. You'll palpate. After you inspect, you have to make sure you inspect the abdomen as well. Make sure there's no distension. You'll palpate, make sure that the patient isn't having any pain. You'll ask them, does this hurt? Can you let me know if I'm causing you any pain or discomfort? You'll check that. So you have your bowel sounds. You also want to check their skin. You'll check for any lesions, any kind of wounds. That's front and back. So you'll ask them if they can turn. You'll ask them to turn. You'll check their skin on the back, head to toe, and you'll check their skin on the front, head to toe. You'll notate any wounds, any scars, any scratches, any rashes. You'll notate all of that on your documentation. You'll also check the radial pulses here.